Many seniors don't realize that the simplest movements can have the biggest impact on their long-term health, especially when it comes to preventing stroke. One of the most powerful yet overlooked daily habits is a specific hand exercise called the finger pulse squeeze. This easy hand move stimulates blood flow, supports healthy circulation, reduces stiffness, and helps maintain flexibility in the tiny blood vessels and nerves of the hands. When practiced daily, this movement promotes proper blood flow back to the heart and brain, which is crucial after age 60, when circulation naturally slows down and the risk of blood clots increases. The exercise is very simple. Extend your hand in front of you, open your fingers wide, then slowly squeeze your fingertips toward your palm, applying mild pressure as if pressing a soft sponge. Hold for 2 seconds, release fully, and repeat 15 to 20 times on each hand. The controlled squeeze and release action works almost like a mini pump, helping move stagnant blood and preventing the thickening or pooling that can lead to clotting. Seniors who practice this move daily often report warmer hands, reduced numbness, and more energy because improved circulation helps the body deliver oxygen where it's needed most. It also helps strengthen the small muscles of the hand, improving grip strength, which is directly linked to overall longevity. Doctors in many senior clinics recommend this exercise because it's gentle, safe, and effective whether you are sitting, watching TV, or even lying in bed. What makes it especially powerful is that it wakes up the vascular system without stressing the joints, making it perfect for anyone with arthritis, diabetes, neuropathy, or weak circulation. Combined with hydration and simple walking, this one-hand exercise can significantly reduce the risk of stroke by keeping blood flowing smoothly and preventing dangerous clots from forming. Doing it for just 2 minutes a day can be one of the most protective habits seniors add to their routine. Stroke prevention often feels overwhelming for seniors, but surprisingly, many protective habits start with something as small as a hand movement. The finger pulse squeeze has gained attention among physical therapists and senior wellness experts because it improves microcirculation, something that is critical after age 60. As we age, arteries become less flexible, and small vessels in the hands and feet are usually the first to show signs of poor circulation. This can lead to cold hands, tingling, or numbness, warning signs that blood isn't moving as efficiently as it should. Poor circulation in the extremities is often linked to a higher risk of clot formation, which can travel to the brain and trigger a stroke. By practicing this specific hand exercise daily, seniors can mechanically stimulate blood flow and strengthen the vessel walls, helping keep them open and flexible. The movement works by encouraging rhythmic pressure changes inside the vessels, which naturally helps prevent stagnation. When blood doesn't sit still, it's far less likely to form clots. This exercise also helps reduce inflammation in the hand muscles and joints, which indirectly supports healthier circulation. Seniors often feel immediate benefits such as warmth returning to their fingers, improved grip strength, and reduced stiffness, especially in the morning. Over time, this exercise helps train the nervous system to signal the vessels more effectively, further improving circulation. The beauty of the finger pulse squeeze is that you can do it anywhere, while drinking morning coffee, waiting for an appointment, or watching TV at night. Even seniors with limited mobility or chronic pain can perform it safely because the motion is gentle and requires no equipment. When combined with deep breathing, the benefits increase even more because oxygen is delivered more efficiently throughout the body. This daily hand movement for many seniors, hand exercises may seem too simple to make a meaningful difference in preventing major health risks like stroke, but modern research shows that small, repetitive movements can significantly improve blood vessel function. The finger pulse squeeze works by creating a natural pumping action through the hands, helping blood circulate up the arms and toward the brain. This movement gently stimulates the endothelial lining of the blood vessels, encouraging them to release nitric oxide, a natural compound that keeps arteries relaxed and flexible. Flexible arteries mean smoother blood flow and lower chances of clot formation, which is one of the primary triggers of stroke in older adults. Seniors often struggle with circulatory issues because their vessels naturally stiffen with age, but this hand exercise helps wake up the microcirculation system. The squeeze and release pattern mimics the effect of walking or stretching, but it's especially beneficial for seniors with mobility limitations who may not get enough physical activity. Many physical therapists recommend this move to their older patients because it is low impact and easy to maintain consistently. Seniors who do it regularly report better finger mobility, fewer cramps, and improved ability to perform daily tasks like holding utensils or opening jars. What makes this exercise particularly valuable is its convenience. You don't need equipment, strength, or perfect coordination. Just 1 to 2 minutes of practice helps stimulate the heart-brain circulation pathway, supporting healthier blood flow throughout the day. Because stroke often occurs due to blood not moving efficiently, anything that encourages rhythm and flow helps reduce risk. In many cases, seniors also notice mental benefits such as relaxation, reduced anxiety, and a sense of calm due to the repetitive, soothing nature of the motion. When paired with proper hydration and moderate physical activity, the finger pulse squeeze becomes a powerful part of a long-term stroke prevention lifestyle. It's a daily reminder that even small habits can have life-changing effects when practiced consistently that may look small, but it plays a powerful role in supporting vascular health and reducing stroke risk by improving blood flow and preventing clots from forming. One of the biggest advantages of the finger pulse squeeze for seniors is that it targets one of the most common hidden risk factors for stroke: poor venous return. Venous return refers to the process of blood traveling back to the heart after circulating through the body. As we age, this process slows down, especially in the hands and feet, causing pooling and thickening of the blood. When blood doesn't cycle properly, clots can form more easily, eventually traveling to the brain and causing a stroke. This hand exercise acts as a circulation booster, helping push blood back toward the heart with each controlled squeeze. Seniors who use this movement daily experience a noticeable reduction in hand swelling, stiffness, and finger numbness because the exercise helps move excess fluid and encourages fresh blood flow. The enhanced circulation helps nourish tissues with oxygen and nutrients, keeping the muscles and joints in the hands healthier. Another major benefit is that the finger pulse squeeze supports arterial health by improving the elasticity of vessel walls. Elastic arteries allow blood to flow smoothly, which lowers blood pressure, a major risk factor for stroke. Seniors often underestimate how much their hand health affects their overall well-being, but healthy hands help support balance, stability, and independence. When your grip is strong and your circulation is steady, everyday tasks become easier and safer. Additionally, this exercise is extremely adaptable. Seniors can perform it slowly for relaxation or more vigorously to energize the body in the morning. Doing this exercise during long periods of sitting, such as long car rides, waiting rooms, or watching television, helps prevent blood stagnation. Over time, practicing the finger pulse squeeze daily helps create a more resilient cardiovascular system, reducing the likelihood of blockages and ensuring the brain receives consistent, healthy blood flow. It's a simple habit with powerful protective benefits. The finger pulse squeeze is especially important for seniors who experience early warning signs of circulation problems, such as cold hands, tingling, or weakness in their fingers. These symptoms often indicate reduced blood flow, which can increase the risk of clot formation that may lead to a stroke. Performing this hand movement regularly helps keep blood moving through the small vessels that often become narrowed or stiff with age. The repetitive squeezing motion strengthens not only the hand muscles, but also activates the surrounding tissues, promoting better nerve function. Many seniors are surprised to learn that improving hand circulation can also enhance brain health, because healthy blood flow from the extremities supports smoother circulation through the entire cardiovascular system. The simple act of squeezing and releasing helps the vessels maintain their ability to expand and contract, which is a crucial function that declines over time. Seniors who practice this exercise often report improved finger dexterity, making it easier to write, type, or manage small objects. It also helps reduce morning stiffness, a common issue caused by fluid accumulation overnight. By encouraging circulation early in the day, this exercise helps prepare the body for healthier movement throughout the morning. Another benefit is that the rhythmic hand movement can help regulate the autonomic nervous system, reducing stress and promoting relaxation. Stress is a significant contributor to high blood pressure, a leading cause of stroke, so any gentle stress relief exercise is valuable. This hand movement can be incorporated into daily routines effortlessly, during phone calls, while reading, or even during short breaks throughout the day. Consistency is key, and seniors who commit to this exercise often experience measurable improvements in both hand strength and overall circulation. Over time, this small movement acts as a powerful protective tool for stroke prevention, keeping blood flow steady, vessel walls strong, and circulation pathways clear. For seniors looking to protect their long-term brain and cardiovascular health, the finger pulse squeeze becomes an essential daily habit because it focuses on strengthening the smallest and often most neglected blood vessels in the body. These tiny vessels, called capillaries, are responsible for delivering oxygen and nutrients to the tissues, and they are typically the first to weaken with age. When capillaries become narrow or stiff, circulation slows, increasing the risk of clot formation that may travel to the brain. This hand exercise directly targets these microvessels by stimulating them through controlled muscle contractions. Every time the fingers squeeze and release, it creates a gentle pressure wave that pushes blood through these narrow passages, helping to keep them open and functioning. Seniors often underestimate the importance of capillary health, yet maintaining strong microcirculation is one of the most effective ways to prevent stroke. The exercise also encourages the body to release more nitric oxide, a compound that relaxes the vessel walls and helps regulate healthy blood pressure. Lower blood pressure significantly reduces stroke risk. Additionally, seniors with arthritis or stiffness benefit greatly from this movement because it gently warms the joints and increases the synovial fluid in the fingers, making everyday tasks more comfortable. It is equally helpful for those with diabetes or neuropathy, as it promotes nerve stimulation and reduces that pins and needles sensation. Because the exercise requires no equipment and can be done sitting or lying down, it is an ideal habit for seniors with limited mobility or balance issues. Practicing the finger pulse squeeze at regular intervals throughout the day, such as once in the morning, once in the afternoon, and once before bed, helps maintain consistent blood flow. Over time, these repeated pulses strengthen the cardiovascular system and create healthier circulation patterns. This small, simple movement can have a profound impact on preventing stroke when performed consistently. Another important reason the finger pulse squeeze is so effective for seniors is that it fights one of the most overlooked contributors to stroke, blood viscosity. As people age, their blood naturally becomes thicker due to slower circulation, dehydration, and reduced physical activity. Thicker blood moves more slowly and is more likely to form clots. This hand movement works as a natural thinning mechanism by stimulating circulation and helping the body maintain a healthier blood flow. The rhythmic contractions act almost like mini heartbeats in the hands, pushing blood through the system and preventing it from settling or thickening. When performed daily, this hand exercise encourages smoother blood movement throughout the body, which significantly reduces the chances of clot formation. Seniors who combine this exercise with proper hydration often see even better results, as water helps maintain ideal blood consistency. Another benefit is that the exercise reduces inflammation in the hands, wrists, and forearms. Inflammation is another hidden factor that increases stroke risk because it stresses the blood vessels and makes them less flexible. By keeping swelling down and circulation active, seniors can protect their vascular health more effectively. Additionally, this exercise helps improve grip strength, a key indicator of overall health and longevity. Doctors often assess grip strength because it correlates with muscle function, nerve health, and cardiovascular resilience. Seniors who maintain strong hands are able to stay more active in daily life, which further helps prevent stroke. Even those with limited mobility can do this exercise multiple times per day, allowing them to still maintain critical circulation even when sitting for long periods. It's also a soothing practice that can help calm the mind and reduce stress-related blood pressure spikes, adding another layer of protection. With consistency, the finger pulse squeeze becomes a simple yet powerful tool in a senior's daily wellness routine. The finger pulse squeeze also plays a crucial role in improving one of the most essential functions for seniors, oxygen delivery. When seniors experience sluggish circulation, the brain often doesn't receive enough oxygen-rich blood, increasing the risk of transient ischemic attacks, TIAs, often called mini-strokes. These events are warning signs that a major stroke may occur if preventive steps aren't taken. This hand movement enhances oxygen transport by promoting fresh blood flow from the extremities back to the heart and brain. As the fingers contract and relax, they help push oxygenated blood through the arteries while encouraging deoxygenated blood to return efficiently for reoxygenation. This cyclical movement strengthens the overall cardiovascular system, boosting the body's ability to deliver oxygen where it's needed most. Seniors often report that after practicing this exercise consistently, they feel more alert, less fatigued, and more mentally sharp. This is largely due to improved blood flow to the brain, which enhances cognitive function. The exercise also supports those who experience brain fog or slow thinking caused by poor circulation. Additionally, seniors with chronic conditions such as hypertension, diabetes, or high cholesterol benefit greatly from this movement because it improves vessel flexibility, promotes healthier artery walls, and enhances nerve communication. This exercise can be performed at any time, but doing it in the morning helps jumpstart circulation for the day, while practicing it at night can help relax the body and prepare it for restful sleep. When combined with slow, deep breathing, the benefits multiply as oxygen intake increases and blood flow improves further. Over time, the finger pulse squeeze helps train the cardiovascular system to maintain steady, healthy circulation, reducing the likelihood of stroke and supporting overall brain function in seniors. Seniors often struggle with conditions such as arthritis, neuropathy, or carpal tunnel syndrome, which can all negatively impact circulation and increase the risk of stroke. The finger pulse squeeze offers a gentle and effective solution because it supports joint lubrication, nerve stimulation, and blood flow, all without causing strain. The squeezing action helps move synovial fluid through the finger joints, reducing stiffness and promoting smoother movement. This is especially beneficial in the morning when joints tend to be more rigid. Because arthritis can limit hand function and decrease mobility, strengthening the hands through regular exercise is essential for maintaining independence in daily activities. Additionally, seniors with neuropathy benefit from this movement because it stimulates the nerves and increases circulation, helping reduce numbness and tingling. By improving nerve function, the hand exercise helps restore sensation and coordination, which reduces the risk of falls and injuries. Enhanced grip strength also supports safer mobility, as seniors can hold onto railings, walkers, or canes more securely. Another major advantage of this movement is that it reduces swelling caused by poor venous return. Swollen hands often signal that fluid is not circulating properly, which can contribute to clotting. The finger pulse squeeze acts as a natural pump, helping move excess fluid out of the hands and encouraging healthy lymphatic drainage. This helps reduce inflammation throughout the body, which is a major contributor to stroke risk. Seniors who practice this movement daily often notice that their hands feel lighter, warmer, and more comfortable. It's also a comforting exercise that can reduce stress and help regulate the heart rate, both important factors in reducing stroke risk. This simple, accessible motion offers a combination of physical, neurological, and cardiovascular benefits that make it one of the most effective daily habits for seniors seeking to stay healthy and stroke-free. One of the most compelling reasons seniors should practice the finger pulse squeeze daily is its ability to support brain-to-body communication. As people age, the nervous system becomes less efficient, and signals can slow or misfire due to reduced circulation, nerve damage, or stiff blood vessels. This hand exercise helps stimulate the nerves in the hands and fingers, which directly connect to pathways that communicate with the brain. When circulation improves, nerve signals travel faster and more accurately. This can help seniors improve coordination, reaction time, and overall cognitive function. In many cases, seniors who practice this exercise regularly report feeling more mentally alert, especially in the morning. The movement can even activate areas of the brain associated with focus and memory because hand stimulation increases blood flow to the sensory-motor regions of the brain. Another benefit is that this exercise can reduce microvascular issues, tiny blockages in the smallest vessels, which can contribute to small, silent strokes that often go unnoticed until they accumulate. By keeping these vessels open and healthy, seniors protect themselves from these hidden dangers. Additionally, this hand movement supports balanced blood pressure levels. Because the exercise is calming and rhythmic, it helps reduce stress-related spikes in blood pressure, which are a major cause of stroke. Practicing this hand movement during stressful moments can be particularly helpful. Seniors can use it as a grounding technique while waiting in line, riding in a car, or during moments of anxiety. Over time, the consistent practice helps stabilize circulation patterns and improve vascular elasticity. By strengthening these systems, seniors become more resilient, lowering their overall stroke risk. This simple daily habit is a powerful tool for maintaining a sharp mind, steady circulation, and strong cardiovascular health. The finger pulse squeeze is especially important for seniors because it helps counteract one of the most common age-related issues, reduced arterial elasticity. As arteries stiffen with age, blood flow becomes restricted and pressure on the vessel walls increases. This stiffening is one of the major risk factors for stroke because it makes it easier for clots to form and harder for the body to circulate blood efficiently. The gentle squeezing and releasing motion of the hand exercise helps improve this elasticity by encouraging the arteries to expand and contract more regularly. This movement strengthens the vessel walls and promotes better flexibility, which leads to healthier blood pressure levels. Consistent practice of the exercise teaches the vessels to respond more effectively to changes in circulation, improving overall cardiovascular function. Seniors who incorporate this movement into their daily routine often experience warmer hands, fewer circulation-related headaches, and improved energy levels. This is because better blood flow ensures that oxygen reaches the brain more efficiently. Additionally, this exercise can help reduce tension in the forearms and wrists, which is often caused by prolonged sitting or limited movement. That tension can restrict blood flow and increase stroke risk without seniors realizing it. The finger pulse squeeze breaks up this tension naturally and gently. It's also an excellent tool for preventing nighttime circulation problems. Seniors who wake up with numb or tingling hands can benefit greatly from performing this hand exercise before bed. The increased blood flow helps prevent stagnation while sleeping. When paired with deep, slow breathing, it enhances relaxation and calms the nervous system, lowering stress levels, another factor that significantly reduces stroke risk. This single movement supports the finger pulse squeeze is also a highly effective way to support seniors who experience chronic stress or anxiety, both of which are significant contributors to high blood pressure and stroke risk. Stress causes the body to release hormones like cortisol and adrenaline, which constrict blood vessels and raise blood pressure. Over time, this constant pressure on the arteries can weaken them, making them more prone to blockages. The rhythmic motion of this hand exercise offers a soothing, calming effect that helps counteract these stress responses. As seniors squeeze and release their hands, they naturally regulate their breathing, slow their heart rate, and encourage relaxation. This leads to a drop in stress hormones and a stabilization of blood pressure. Many seniors find that doing this exercise during moments of tension, such as while waiting in line, dealing with frustration, or trying to fall asleep, helps calm their nervous system. In addition to its mental benefits, the exercise supports the physical aspect of circulation. When the mind relaxes, the blood vessels relax too, allowing smoother blood flow. The finger pulse squeeze can become a grounding technique that seniors return to throughout the day, helping maintain emotional balance and cardiovascular protection. This exercise also strengthens the neural pathways between the hands and the brain, improving cognitive performance and emotional regulation. Seniors who practice it often feel more focused, patient, and stable. It can even help reduce the symptoms of restless hands or fidgeting caused by nervous tension. The combination of mental calmness and improved circulation makes this hand movement a powerful two-in-one tool for stroke prevention. It supports the body, mind, and heart simultaneously. Another important benefit of the finger pulse squeeze is its ability to improve seniors' fine motor skills, which naturally decline with age due to reduced nerve sensitivity and weakened muscles. Fine motor skills are essential for everyday tasks like buttoning clothes, writing, cooking, and using electronic devices. When these skills weaken, seniors often become less active, which further reduces circulation and increases stroke risk. This hand exercise helps strengthen the small muscles in the hands and maintain proper nerve function, keeping these skills sharp. Each controlled squeeze stimulates the sensory receptors in the fingers, which sends signals to the brain to stay active and responsive. Regular practice keeps the neural connection strong, supporting better coordination and precision in daily tasks. This improved functional ability also helps seniors stay independent, active, and engaged, three major pillars of long-term cardiovascular and brain health. The exercise is especially helpful for seniors living with conditions like Parkinson's, essential tremors, or early-stage cognitive decline, as it helps keep neural pathways active. By maintaining strong sensory awareness in the hands, seniors experience improved reaction time and greater control during daily activities. The exercise also supports circulation in the wrists and forearms, areas often overlooked but crucial for hand function. Performing the finger pulse squeeze before tasks that require precision, like writing or cooking, helps warm up the muscles and increase blood flow, making the task easier and safer. Over time, seniors who practice this movement notice improved steadiness in their hands, reduced shaking, and greater overall hand confidence. This improvement in fine motor skills indirectly supports stroke prevention because increased activity promotes better circulation throughout the body. When seniors feel capable and confident using their hands, they naturally stay more active, helping keep their cardiovascular system strong and resilient. The finger pulse squeeze is especially beneficial for seniors who experience nighttime hand numbness or tingling, a common sign of reduced circulation or nerve compression. These symptoms often occur when blood flow slows during long periods of rest, and they can be early warning signs of vascular problems that increase stroke risk. Performing this hand exercise before bed helps stimulate circulation in the hands and arms, reducing the likelihood of waking up with numb or asleep hands. The controlled squeezing motion moves blood away from stagnant areas and helps replenish tissues with fresh oxygen. This reduces pressure on the nerves and supports smooth circulation throughout the night. Many seniors find that performing this movement for 1 to 2 minutes before sleeping improves their overall sleep quality because it reduces discomfort and helps relax the body. The exercise also helps those who experience hand swelling in the morning. Swelling often occurs when poor circulation causes fluid to accumulate during sleep. By stimulating circulation, the finger pulse squeeze encourages lymphatic drainage, reducing puffiness and stiffness upon waking. Seniors who practice this exercise regularly report easier movement in the morning and greater comfort throughout the day. Additionally, this movement helps prevent microclots that may form during periods of inactivity, a major cause of early morning strokes in older adults. The gentle movement strengthens the vessel walls, keeping circulation consistent even during rest. Combined with proper hydration and deep breathing before sleep, this exercise supports cardiovascular stability and lowers stroke risk significantly. By making it a nightly habit, seniors can protect their hands, brain, and heart with one simple movement that takes less than 2 minutes. The finger pulse squeeze is also widely recommended for seniors because of its ability to improve circulation in the upper body, specifically in areas that often suffer from stiffness due to limited shoulder and neck movement. Many seniors experience tension in the upper back, neck, and arms, often caused by posture changes, arthritis, or long hours of sitting. When these areas become tight, blood flow to the brain can be restricted, which increases stroke risk. Although the hand exercise seems small, it indirectly releases tension in the upper body by improving blood movement along the arms and stimulating nerves that travel through the shoulders and neck. As seniors perform the squeeze and release motion, the muscles in the hand, forearm, and upper arm engage in rhythmic activity, encouraging better overall circulation. This increased blood flow helps relax the upper body muscles, reducing pressure on the arteries that supply the brain. Seniors who practice this exercise regularly often report fewer headaches, reduced shoulder stiffness, and better overall comfort. This is because improved circulation loosens tight muscles and allows them to function more normally. The exercise also helps reduce pressure on the cervical spine, which is responsible for sending blood to the brain. When circulation improves, seniors feel clearer-headed, more focused, and less fatigued. This is especially helpful for those who spend long periods sitting or looking down at phones or tablets. The finger pulse squeeze can be performed anytime during the day to refresh circulation and relieve upper body tension. Even 1 or 2 minutes can make a noticeable difference. Over time, this hand exercise supports better posture, more stable blood flow, and healthier brain function. Its benefits extend far beyond the hands, making it a powerful tool for seniors who want to reduce stroke risk and maintain strong overall vascular health. Another significant benefit of the finger pulse squeeze is its ability to help prevent silent mini-strokes, known as microinfarcts. These tiny strokes often go unnoticed because they are painless and produce minimal symptoms at first. However, over time, they accumulate and can lead to memory problems, cognitive decline, or early dementia. One of the major causes of microinfarcts is poor circulation through the brain's smallest blood vessels. This hand exercise helps keep blood flowing smoothly and prevents microclots from forming. The repeated squeezing motion strengthens the delicate capillaries and encourages them to remain open, flexible, and responsive. Seniors who practice this movement daily support better brain health by ensuring that oxygen and nutrients reach every part of the brain. Improved circulation also strengthens the blood-brain barrier, a protective layer that keeps harmful substances out of the brain. Another advantage is that this exercise helps regulate blood pressure spikes that can trigger microstrokes. Because it is calming and rhythmic, it assists in maintaining stable pressure levels throughout the day. Seniors who practice it during stressful situations often notice immediate tension relief. This long-term calming effect helps reduce the wear and tear on the arteries that feed the brain. The exercise is equally helpful for seniors with diabetes or high cholesterol, two major risk factors for silent strokes, because it keeps blood moving and reduces chances of fatty buildup in the vessels. Over time, the finger pulse squeeze acts like a microcirculation workout for the brain. It strengthens neural connections, supports memory, and helps protect cognitive function. Combined with hydration, gentle walking, and deep breathing, this small daily movement becomes one of the most powerful habits seniors can use to protect their brain health as they age. The finger pulse squeeze is particularly beneficial for seniors dealing with mobility issues, bedridden recovery, or limited physical activity. When the body is inactive for long periods, circulation slows dramatically. Blood tends to pool in certain areas, increasing the risk of clot formation. This is especially dangerous for seniors who cannot move frequently, such as those recovering from surgery or living with chronic conditions that limit mobility. This simple hand exercise provides a safe and effective way to keep circulation active without requiring full body movement. The rhythmic squeezing engages the muscles of the hand, wrist, and forearm, which in turn stimulates the veins and encourages blood flow. This helps move stagnant blood and significantly reduces the chances of clot formation. It also supports oxygen delivery to the tissues, which helps prevent muscle wasting. The exercise is safe for virtually all seniors, including those with joint pain, arthritis, or early-stage frailty. Because it does not require weight-bearing, balance, or coordination, it can be performed while lying down, sitting, or even during physical recovery therapy. Seniors with respiratory issues also benefit because the gentle motion encourages calmer breathing patterns. This improves oxygen intake and complements the circulation boost created by the exercise. Caregivers can encourage seniors to perform the movement multiple times per day, especially during long periods of rest. Even 30 seconds every hour can help maintain healthy circulation. This is crucial for preventing stroke, deep vein thrombosis, and fluid retention. The finger pulse squeeze gives seniors a sense of control over their health, even when mobility is limited. It empowers them to take small steps that lead to major improvements in cardiovascular stability, making it a vital habit during any recovery period. One often overlooked benefit of the finger pulse squeeze is its ability to support hand warmth and temperature regulation in seniors. Cold hands are a common sign of weakened circulation and narrowing blood vessels. When blood doesn't reach the extremities efficiently, it also struggles to return to the heart and brain, a dangerous pattern that increases stroke risk. This hand exercise helps warm the hands naturally by pushing fresh blood into the fingers and encouraging consistent circulation. Each squeeze increases blood flow, while each release allows oxygen-rich blood to refill the vessels. This natural pumping effect helps restore warmth and improves comfort. Seniors who struggle with cold hands often find immediate relief after performing this movement for just 1 to 2 minutes. Warmer hands indicate improved circulation throughout the entire upper body, not just the fingers. This means the blood is flowing more smoothly toward the heart and brain as well. This improvement is crucial for preventing clots and supporting brain health. Another benefit is that warmer hands make it easier to perform daily tasks like writing, cooking, or dressing. Stiff, cold fingers often lead to reduced mobility and increased frustration. By practicing the finger pulse squeeze, seniors maintain joint flexibility, stronger grip, and better overall hand function. The exercise also improves circulation in colder climates or during winter months when blood vessels naturally constrict. Doing this hand movement before going outside can help warm the hands and prepare them for temperature changes. This prevents sudden drops in circulation that can increase clot risk. Consistent practice keeps the arteries more flexible, which supports better blood flow even in difficult weather conditions. The combined effect of improved warmth, stronger circulation, and better hand mobility makes this exercise invaluable for seniors. The finger pulse squeeze stands out as one of the most powerful yet simple daily habits seniors can use to protect themselves from stroke. While many stroke prevention strategies involve complex diets, medications, or strenuous exercises, this hand movement requires no equipment, no physical strength, and almost no effort, yet delivers significant cardiovascular benefits. Its ability to stimulate blood flow, strengthen vessel walls, improve nerve function, and regulate blood pressure makes it a unique all-in-one health tool. Seniors who adopt this exercise into their morning and evening routine experience noticeable improvements in hand mobility, mental clarity, energy levels, and circulation. The rhythmic motion encourages steady blood flow to the brain, which reduces the risk of clot formation and supports healthier cognitive function. It also prevents stagnation during long periods of sitting, which is one of the leading risk factors for stroke among older adults. This movement is a lifelong habit, safe for seniors in their 60s, 70s, 80s, and even 90s. Whether performed during relaxation, watching TV, reading, or before sleep, it fits naturally into daily life. Over time, the finger pulse squeeze creates stronger, more responsive blood vessels, healthier circulation patterns, and a more resilient cardiovascular system. Seniors gain confidence knowing they are taking daily steps to protect their heart and brain. By committing to this simple exercise, seniors empower themselves with one of the most effective tools for long-term stroke prevention, proving that even the smallest movements can create life-changing benefits.